I'm very excited. This is our first time meeting in person. I don't know if you know or remember this. It's on like way back in our emails if you look. But I used to, like, I was a listener of the Food Heaven podcast.
Okay.
And even before I joined Dear Media. And I remember during, it was definitely COVID, because I remember being not in my apartment because I was out at my parents' house in Jersey. But I remember emailing you guys being like, I'd love to have you on my show. Like, I love what you're doing. And I think it was also during BLM. So I know that, like, you were at cap of, like, guesting. But you offered something that I really appreciated, of being able to use the audio of one of your episodes to run on my feed as like an introduction to you guys.
Yeah.
And so I was like, I'd love to share what you're doing. And so if you can't guest, like, is that an option? And you said yes. And I was so appreciative. So we ran one of your episodes within my feed of my show. And I've continuously followed you from before then, but then after. And when you guys released the Pivot series, I was like hooked. I was so interested because as someone who's a creator, I felt very in line with everything you were saying. But I also think that it applied to so many people, whether they were creators or not. So I'd love to like dive in first there into what caused the pivot, why you wanted to share it so publicly, which is something I appreciated so much. And then also feedback from listeners, because I'm assuming most of your listeners are not creators, which I think goes to show that it did kind of apply to everyone. So Wendy, welcome to the show.
Thank you. I do remember that email, and I remember hitting up Dear Media like, hey, is this okay? Like figuring out all the logistics of it all.
And it was before I was with Dear Media. So I was like actually talking to them, and I was like, oh my God, I would love to be a part of the network. But you guys were so kind, and you were like, yeah, sure, here's the audio file. And I was like, great.
I remember that. So for people who don't know me, Food Heaven was a platform, or is a platform, we're just not as active anymore, that I have with one of my best friends, Jess, who's also a registered dietitian. And we were doing Food Heaven for over 10 years.
Which is long.
Yeah, it's a long time. Before we even became dietitians, we were working together here in New York City at like a local farmers market, and we wanted to do something creative together. And it started off as just like a passion project. We wanted to do like education. We were in one of the local channels in Brooklyn. Like that was what it was. And then once social media started kicking off, we were like, oh, let's put these videos out online. And then it just kind of evolved from there. So we did it for a really long time, and eventually we started working with different brands, and we had the podcast, and just so many things came out of Food Heaven, and we just loved doing it. Like it was just like we had a good time doing it. We were able to, because with nutrition it could get clinical for most people, where you're working at a hospital, and this was like a way for us to be creative and do recipes and work with different brands, and also it became profitable, which we had no idea that was even a thing. We were like, oh wait, you can make money doing this, and you know, like a few years after doing it, it was able to cover our bills, and it was like our job, it was our main thing. And then fast forward to 12 years later, just like the landscape changed completely with social media. And initially, it was just so much fun. Like you created for the sake of creating, and it wasn't about analytics and numbers and output, you know. But I'm sure you know, like with Instagram, that completely changed the game, and just like all of their algorithms and trying to keep up. And I'm like, I'm just getting too old for this. I was like, I can't keep up with like the, you know, now it's like first it was the photos, then it was the reels, and then it's like the voiceovers, and then you got to keep up with the trending audio. And I'm just like, this is too much. And just becoming like really stimulating. And then TikTok came out, and it was like, I was like, oh my, I mean, to this day, I'm not on TikTok, but I had to learn about it because I was like, that's what's in it. And now that we're relying on this for our livelihood, we have to keep up with the times. And, you know, and that was fine up until it wasn't. Like a few years in, we were like, yeah, this is not enjoyable anymore. We're stressed out about, is this going to perform well? When you're working with brand partners, they want to see results with, you know, what you're posting, especially if they're putting money behind it. And that becomes really stressful because you're not creating based on what you want to do. You're creating based on what the trends are and what is going to do well. And I feel like that hinders a lot of people. So yeah, it just wasn't like, it just wasn't sitting well. We were just kind of brewing like, what are we gonna do next? Because we love working together. We work together really well, and we wanted to still maintain some kind of business relationship. But we were like, yeah, we don't think it's gonna be through Food Heaven, because we're just tapped out. So that's what happened there.
But what made you guys decide to publicly work through this process in real time?
Yeah, we're very close to our audience, because they've been. I mean, some of our audience has been with us since before we were even dietitians, like years and years, and we didn't want to just ghost people.
Right.
Like, we were like, let's just be transparent about what's happening, and also like a lot of the people that do follow us are dietitians as well, and we thought that it would be valuable to just share and be open. We're very open about numbers. Like, even people be like, well, how much do you charge for this, or what's, and we're just super transparent, because you know, a lot of people are getting gypped by these brands, and or like they're giving way too much of themselves, or they're burned out, and they're like, no, just keep pushing through it, even though their mental health might not be doing so well. So we just wanted to be honest with people, because we were like, oh, well, you know, maybe other people can relate to this. And like, so many people were like, oh my God, you know, like, I didn't know all of the behind the scenes, and they were really grateful that we were so open about the process, and open about all of it, numbers and what it really looks like behind the scenes. And it's like, yeah, it's not so like glitz and glammy as it seems to be an influencer. You don't just like get all this free product, you know what I mean, and have all these great brand sponsorships. Like, it's a lot of work.
Yeah, I mean, yes, they're like, I say it all the time, I love my job so much, but it's still a job.
Yeah,
I think that no one fully comprehends that until they see it firsthand, whether your like significant other is doing it, or your close friend is doing it, or you're working with someone who's doing it.
Yeah.
From the outside, it looks all sunshine and roses, and it's not. But I'm curious mentally, because I think this applies to so many people, creator or not, how that felt, because I imagine it'd be kind of terrifying to really come to the realization like, oh, we're fully gonna pivot.
Yeah.
And what was that process like for you guys to work through?
Yeah. It was hard, because we've been doing this for so long, and we were like, well, what does our life look like offline? And we're like, well, most of our life has been offline. Like, let's try to tap back into that. And so we haven't really been online since, honestly. We're not super active. And that provided a lot of clarity for us in terms of like, well, what do we enjoy? Like, that isn't so reliant on what is trending and what is in. So just that pause was really helpful in facilitating conversations between Jess and I, because it's not just me. It's not like, oh, this is what I want to do. It's like, well, how are we going to try to work on something together? And we had a lot of conversations, and we got someone to help facilitate the conversations as well, like a mentor. And some of those conversations were difficult, because, you know, someone that I've been working with for such a long time, who's one of my best friends, and there's been a lot of ups and downs. Overall, it's been great, but we're like, okay, well, how can we do things better? Like, how can we be more intentional about our work relationship? Because we were just winging it with Food Heaven. Right. We were like, hey,
I feel like we all are, to be honest, in this space. Like, I feel like we're all kind of just throwing shit at the wall.
Yeah, and seeing with sticks. Yeah. We were like, okay, like, you know, we started in our early 20s. We were just like winging it and seeing like, okay, you know, but we weren't really super intentional. We wanted to be this time around, because we're older now. We know a lot more about business, and just professionally, we're a lot more seasoned. So we're like, no, let's be super clear on what it is that we want, and also what our relationship is going to be like in terms of like the work side. And that took months and months of just talking and you know, having different people like help us figure things out. And then we came to Diabetes Digital, which is the new business that we launched earlier this year. And we're like, oh my God, this is because we're both. So Diabetes Digital is a diabetes, it's a diabetes tech platform, and we provide nutrition counseling. It's covered by insurance. So most of our clients pay zero out of pocket. For people that have prediabetes, diabetes, PCOS, like any form of insulin resistance. And Jess and I are diabetes educators. Like, we've been diabetes educators for a long time. But with all of the social media stuff, we felt like that message was getting lost, because we weren't really tapping into what our expertise was. We were doing whatever needed to be done at the moment, you know, to like pay the bills and keep a platform alive. And we were like, we want to get back to what we were passionate about when we came into the field. And so many people have prediabetes and diabetes. So we were like, this is just perfect. And we're more behind the scenes. We don't have to be front facing. Like with Food Heaven, we were the brand. It's like there's no
It's
no
like my
Food
work.
Heaven.
Yeah.
You have to show up.
Mm-hmm.
And in thinking about scaling a business, we're like, we don't want to be the face of a brand. We want to, do all of the logistical things and, just like everything that it takes to run a company. But we don't we want the company to be able to run without us having to physically show up every time.
Totally fair.
Yeah.
Dream about it? No,
Yeah.
I mean, yeah. I've thought about that, and like there are days where I dream about that, and then there are days where I'm like, how nice is it that I can kind of just be myself, and that is my job. It's very confusing to work through mentally.
Yeah.
In terms of Diabetes Digital, what did either of you struggle with diabetes? Like, what was the initial interest in diabetes back when you originally became diabetes educators?
Yeah. There's just so many people in our family and our community that have diabetes. The rates are significantly higher in Black and brown communities. So when we first started off working at farmers markets, we were working in the Bronx, and you of course knew someone that had diabetes or prediabetes. Jess has very close family members. And so it was just, and what I love about diabetes, not that people are going to love having diabetes, but as a clinician, there's just so much that you can do. And I feel like there's just like a lot of opportunity there for education, especially education that's like culturally relevant. And so that was our drive for getting that certification.
Okay.
Yeah.
Why is it so much more prevalent in Black and brown communities?
Oh, there's so many reasons, like access, socioeconomic factors, genetics can be part of it. But really, like, if you go to, we're in New York City now, if you go to the outer boroughs, like, to get a medical appointment, it can take up to 6 months. Like, these clinics are scheduled out. You have to wait a really long time. You're not getting preventative care. And you also don't have access to someone like a dietitian, because maybe your insurance doesn't cover it. Like, there's just so many socioeconomic factors that are at play.
And what would be the symptoms of, well, I guess actually, rewind. What actually is the difference between pre-diabetes and diabetes? Obviously, I know that one comes potentially before the other with the pre, but like, what is the medical difference there?
So there's 2 types of diabetes. There's different types, but the 2 main types are type 1 and type 2. And type 1 is less common because it's an autoimmune condition, and people typically get it younger in age, and that's when your body's attacking the cells that produce insulin in your pancreas. So you're really not making much insulin. You do have to take external insulin through medication. With type 2, it's more of a progressive condition. So there are children and adolescents who get it, but typically it's older in age, and your body is either not using the insulin the way that it's supposed to, that you naturally make, or your cells are really resistant to it. You may or may not need medication with type 2. As you get older, the risk for, not necessarily the risk, but the need for medication is probably going to increase because your organs aren't working the way that they used to. And then there's prediabetes, which is the precursor to type 2, because type 1, there is no prediabetes. Prediabetes would come before type 2. And in terms of knowing, what would be the diagnostic, tools and things like that. Usually there's no symptoms. For prediabetes, there's no symptoms. Symptoms occur when you have uncontrolled diabetes. And that would be like you're urinating often because your body's trying to get rid of all the glucose. You have blurry vision because it's affecting the vessels in your eyes. You're really thirsty. You're fatigued. Those are some of the symptoms, but that's like when your blood sugars are really high. So that's the thing, that like you might be having this condition that's progressing, and you don't know if you're not going to the doctor and you're not getting these tests. And typically doctors will associate diabetes to people that are at a higher weight. So people that are at a lower weight and have like a genetic predisposition, like they have family members who have had diabetes, they might not be getting testing for it because the doctor's like, oh, you're fine, you're thinner. And so they get overlooked, and you might have had this condition for years. And
it's testing blood work?
So the blood work, one of the main ones is the A1C, is the hemoglobin A1C. Normal, and I recommend that anyone get an A1C done, because the doctors will be they'll be like, no, you don't need it, and I get it. I recommend that anyone get it once a year.
Okay.
If you have a family history, probably twice a year whenever you do your physical. Normal is less than 5.7, and then anything over 6.5 is considered diabetes. There's also fasting blood work, so like when you don't eat anything and then you go to the doctor. Less than 100 for fasting glucose is considered normal. And then 126 and over is considered diabetes. And then I know now people are using like the monitors and the CGMs. So you could also assess your values like after you eat to see where they are. And normal would be less than 142 hours after eating. And then anything over 200 would be considered diabetes.
Okay. And say I'm having some of these symptoms, or I get the blood work done because I have family disposition. Is that the right word? Family?
Yeah, like you have a family history. Yeah.
What is the path for someone with diabetes, and how does that tie into the treatment that you guys are offering? Because what you said initially is like you love that there's actually something that can be done. Like, what are those steps?
It's so individual. So it depends where your labs are. Like if you go in and you're diagnosed with diabetes and your blood sugars are spiraling, the priority is keeping you alive. So getting that down, and you might need insulin to just like help bring it down initially. And then kind of seeing where things are, like how much has it progressed, what kind of medications would you need, if any. Now for someone who is like in the earlier stages, it's kind of borderline, or just to give you context, like if your A1C is like 13, then you're probably going to need some medication to start off. But if your A1C is in the 7s, in the 6s, then we could, start doing different things in terms of lifestyles. So nutrition is what we focus on, but there's so many other things. There's like sleep, there's stress. So that's what we provide through counseling. It's not just nutrition. It's like assessing all those things, because that can raise your glucose levels if you're really stressed out, if you're not sleeping well. And then with nutrition, there's so much that can be done, just like incorporating more fiber, trying to pair carbohydrates with fat and with protein. Because with diabetes, oftentimes people think that they should be restricting carbohydrates. And that's where a lot of the disordered eating comes in, where they have a history of just cutting things out because they might have seen family members with diabetes and they're scared. And then they get diagnosed and they're like, I'm only eating like chicken salads or whatever. And that's not sustainable, and it's not really necessary. So we guide them on how to pair foods, how to time foods, so that you have a good balance with your glucose throughout the day.
We hear a lot about these like low blood sugar diets or something along those lines. Like,
okay, like lowering your...
Yeah.
Okay.
Like, I don't know. I feel like I see them all over social media, especially in terms of PCOS.
Yeah.
I feel like we just did an episode on PCOS that was amazing and so knowledgeable, and I feel like I learned more in that one episode than I did in any health class in my entire life or textbook. But I feel like a lot of my specific For You page, I don't know why I don't have PCOS, is like, make a protein-packed breakfast with me as someone who lives with PCOS. Like, what is it, I guess, that we should be, if you're trying to lower your blood sugar? Can you give us examples of like what we're actually supposed to be eating?
Yeah, I think that's common with PCOS, similar to why it's common for diabetes, because with PCOS, insulin resistance is very common. People with PCOS are at a higher risk of developing diabetes. And so, that's why it's common for people to say, oh, eat more protein, cut back on the carbohydrates and things like that. And I mean, ultimately, you have to think about what's going to be sustainable for you. Some people do better on lower carb diets, and that's totally fine, but you have to assess, because if you're cutting out carbs or you're like lowering them to the extent that you're binging later on, or you're feeling deprived or you're really hungry, then that's not really a healthy way to go about it, because you can increase the carbohydrate and balance it with like protein, healthy fats, and still have that balance. So it's super individual, and that's why with TikTok it's like kind of scary, because you have these people that they give blanket recommendations, and it doesn't work that way. Like, your body is your body, and it's not like the next influencer who's like promoting these shakes or whatever. You have to see how your body responds to certain things. But generally, I mean, there are recommendations like trying to add lots of plant foods to your meals whenever possible, all types of like vegetables with carbohydrates, trying to go for whole grains when you can, or just like complex carbohydrates that aren't going to cause spikes as much as like the more refined carbohydrates. But if you are going to have like something with added sugar or something that is refined, you can add things like greens or protein. You can add things like nut butters and avocado and nuts and all types of things to help balance it out. And so you feel more satisfied too.
Yeah. I mean, I just feel like that's kind of how we all
Yeah.
diabetic or not, should be eating.
And that's
Am I
the
wrong?
thing. Like, there's not like a special diabetic diet
Right.
that we, it's just like it's a balanced plate, really. And then we take into account your individual situation, like what's going on with your numbers and things like that. But it's not something so far removed from like what we would generally recommend, right?
Right.
For like anyone who wants to eat a more balanced plate.
Now, I want to get into, because I know you guys talked about this, and it's a very hot topic. I feel like it has been for a very long time, and it continues to be, but Ozempic, because from what I've seen is Ozempic being used for weight loss, and then a lot of backlash because people who are diabetic, who were once on Ozempic for diabetes, aren't getting the access. I don't know if that's still as much of a thing.
Yeah, it is.
It is
because there's a shortage in a lot of these local pharmacies. And so people with diabetes go in, and they've been doing really well on Ozempic because it's intended for type 2 diabetes, but people use it off label for weight loss. And yeah, I mean, that's become a huge issue where like doctors have to prescribe other medications because they're not able to get the Ozempic. So yeah, it's a big issue. And it's, I mean, I don't know. I'm like, is it still trending? Like, I know there was like a huge,
very much so.
Like,
very much so. I think.
Yeah. Because I'm so tapped out, but I know there was like it was like just huge.
It was everywhere.
Up until a few months ago, but I haven't been like super tapped into like what's happening.
Well, I guess, okay, my first question on that topic is like, how does Ozempic help diabetes? What's that correlation?
So it slows down the release of glucose into the bloodstream. It slows down gastric emptying too. So like it takes more time for your food to digest, and there's like a slower release there. It has different mechanisms, and it is really helpful for people that have diabetes. It's been like studies have shown that it lowers A1C, which is like your average blood glucose. And clinically, I mean, because I worked in a hospital setting, and it helps so many people with diabetes that I personally worked with. So I think it's a great medication. It has like significant side effects for a lot of people. Some people don't experience any, but most people do, just like stomach upset because you're changing, all the mechanisms and things. And so it's usually a gradual dosing so that your body can adjust. Some people don't adjust, and they just have to like change to another medication entirely. There's some where they're weight loss and their diabetes, and then there's some that are only weight loss. So,
and Ozempic has been something that's been helping people with diabetes for a long time now.
Yeah, I mean, it's been out for a few years. It's not like it hasn't been around for that long, because I was actually part of the initial launch of Ozempic, because I was working with just like the education, like patient education, and helping people know how to dose it properly and things like people that have diabetes.
Right.
But it wasn't, it's only been a few years. It hasn't been out that long.
I just remember having this realization, I don't know, I guess like a year ago or however long ago, when it became as trending as it is now for weight loss. I had the realization that like, wait, this is the commercial Ozempic, and I was like, wait, this has been a while, this isn't new. Like, I never knew that those were the same two things, and I think a lot of us are just realizing that, if that makes sense.
Well, there's different classes, right? Because like Ozempic came out, but then there's other medications that are within that same class that have been around, and there's different, whether it's diabetes or weight loss medications. Ozempic is not for weight loss. That's not the primary purpose, but there's been other medications within that class for diabetes that have been out. So I think Ozempic is just like the brand name that came out within the past few years. Yeah.
Okay. Do you have thoughts or opinions on how it is now being used? I won't say misused, but how it's being used for things outside of diabetes, as like a clinician who's worked with it?
Yeah, as a clinician, because we look at the research. So for weight loss, there hasn't really been much research behind it. And that's why Ozempic, like on their website, you're going to see that they put this is for type 2 diabetes, because they can't promote it any other way, because they haven't done research specifically for weight loss for people that don't have diabetes. As far as I know, that was like the latest that I saw a few months ago. Research is always changing, and these pharmaceutical companies are super profitable, so they might do new research to see like, okay, well, how does this affect people who don't have diabetes, and how does it influence their weight? From just my clinical experience, what I've seen is that people who get on Ozempic for weight loss, there might be an initial weight loss, but then it's hard to stay on Ozempic forever. So eventually they get off of it, either because the side effects are very unpleasant or it's not very affordable because your insurance is not going to cover it, or whatever reason. And then the weight goes back up. It might go up even more. You have like a lot of yo-yoing with your weight. Yep. That's typically what I see. Whether it's Ozempic or like any of these like medications that influence your weight. So it's just something to consider, because like, how sustainable is this going to be over time? Right. And also, kind of questioning like, well, why do you want to lose the weight? Those are conversations that we like to have with people who have struggled with body image, and kind of digging deeper into that. And that's hard work to have those conversations and like reflect on, why you want to be thinner, and like kind of questioning those like beauty norms. And also like, how is your well-being affected by all this? Because people associate weight with well-being, but that's definitely not the case. And you might be compromising like your appetite, your ability to digest, to absorb nutrients, because you're taking a medication like this. We don't tell people what to do. It's like, you do what is best for you. We try to just inform and provide education around like what the research says, and just kind of help you figure it out.
Yeah, I appreciate that, because I do feel we see a lot of blanket statements, which just doesn't necessarily work. One of our all-time favorite brands in this household is Little Spoon. We cannot get enough of them. Truly, they have saved me so many freaking days, whether it be for lunch or for dinner, when I'm like, oh, what are we having? What are the kids having? I don't have any groceries. And then I open our freezer and I'm like, oh, don't worry. Do not worry, because we have Little Spoon. Little Spoon has a variety of options for depending on the age of your child that's eating solids, whether it's their baby blends or their smoothies, which both my baby and my toddler are obsessed with and we always have on hand, or their plates, which our toddler loves for dinner. This is one of his favorites. It's the chicken nuggets. It's chicken and vegetable patties in whole wheat breading, sweet potato, carrots, poppers, and broccoli. Honestly, I freaking love the sweet potato and carrot poppers. Delicious. There have been multiple times where I have actually had one of these meals as my dinner, because I also don't have groceries for myself. The Biteables are perfect for our 10-month-old who isn't, he will eat these plates, honestly, but the Biteables are even more perfectly portioned for him. They have snacks. They even have the lunches that we sometimes will send with our toddler to camp or school for lunch. They have everything we need. And I love their food, but I also love that it comes right to my door. There's nothing better. Truly, there's nothing better than having food delivered right to your door, especially as a parent, and just not having to worry about it. I love Little Spoon so much. My friends love Little Spoon so much, and I know you will too. Simplify your kiddos' mealtime with 30% off your Little Spoon order. Go to littlespoon.com/Cameron30 and enter our code Cameron30 at checkout to get 30% off your first Little Spoon order. We got some listener questions that I am curious about as well. So if your blood work shows pre-diabetes, this kind of goes back to my question between the two, does that insinuate that if not treated, it could then become type 2 diabetes?
You're at a higher risk. I will say, like, if you're diagnosed at an older age with prediabetes, your risk increases for type 2 diabetes. If you're 45 and younger, the research indicates anywhere from 10 to 15% of these people will progress into type 2. So it's not a huge percentage if, you're 45 and younger. But it is a progressive condition. And so you might remain in the prediabetes range, but you might be progressing closer to type 2 diabetes. It's just something that you definitely want to keep an eye out on. But it's not like 100% you're going to get type 2, but you're at a higher risk.
And if you find out you are pre-diabetic, obviously this is individual, but the question was how to prevent from getting to that type 2 level, type 2 diabetes.
Yeah. I would say movement is going to be really important because
specific type of movement, or
both cardio and resistance, because when
Okay.
you're engaging your heart and your muscles, you become more sensitive to insulin, which means that your body can use it
Interesting.
better. Your cells are using glucose more effectively, so you want to try to engage your muscles. And it doesn't mean you have to do any crazy workouts. Like, it could be as simple as like going on a walk. Like, I know for some people, they eat their meal and then they go on a walk after and they test their glucose, and it's come down significantly because your cells are using up that energy. So really thinking about what's enjoyable. There's so many different types of movement, like literally whatever, like hiking, dancing, yoga, like whatever you enjoy. Just trying to get your body moving is going to be really important. Stress reduction, trying to, just like figure out what that looks like for you. There's like constant stress. I feel like left and right, just living
just
and existing in the world.
today's world, especially on an election year.
Right, exactly. It's like, and surviving COVID, so, and it's like, it's crazy because during the pandemic, Jess, just with the stress of it all, she developed pre-diabetes.
Oh my God.
Because she was just, and it's like anything could throw your numbers off if you're like in a chronic stress environment. So trying to figure out like what are some ways that I can, reduce and just like have outlets to, get some joy and just like some kind of outlet to get that stress out. Sleeping well, which I mentioned, and then with nutrition, whenever you're having meals or snacks, try to always have like that balance of macronutrients. So
Can we get into that?
yeah, I'll give you examples. Like protein salads are really popular, right? But you want to still add carbohydrates in there. So let's say, I don't know, you're having like your greens with like salmon or whatever, chicken. But then you're also going to add in like a sweet potato, or you're going to add in like some kind of whole grain like rice or even beans that have protein and carbohydrate. So it has like a nice balance in there. And then you could add like olive oil for fat, or you could add some avocado or nuts or things like that just to help create that balance. So I like to keep that in mind even with snacks. Like if you're going to have an apple, try to have it with some nuts so that you have a better balance, or with some cheese even, if you don't have any issues with cholesterol. And so thinking about combinations, versus just like picking something up.
It's so interesting because when you say this, like obviously I understand that it makes sense, but then I also think back on my own experience of like how I feel after eating a meal.
Yeah.
And I will just take yesterday, for example. We were wedding dress shopping for my little sister, and I was ravenous. And we found out that there was a spring bone right next to where we were, which is like one of my favorite easy pickup spots. And one of my favorite plates from there is this platter that's like rice, beans, barbacoa beef, and like a cabbage slaw.
Perfect.
And I ate that for lunch, and I was like, I wish I could have this every single day.
Yeah.
Like that is my favorite. If I hate lunch, I hate making lunch. It's my least favorite. It actually drives me insane. I can't explain it. But if that was just prepped for me every single day, because I hate making lunch, if I could just get ahead of it and meal prep that for me, or if somehow it could be made, I felt so amazing the entire second half of the day.
Yeah.
And it's because I'm actually fueling myself. Like there's just such a difference in how I felt versus when I'm home and I'm like, fuck, I have to make lunch. Okay, fine. I'm going to throw together like a fried egg and avocado toast, which is fine, but it's not filling enough for me.
Right. You need a little bit more. And it's about the practicality, because in the wellness world, like buying food out is looked down upon. Like you should be making all your meals. And like that's just not practical.
No, I can't.
Yeah. Like it's just not practical, and you are not like a bad person for buying food out, whatever that food might be, to like just try to keep your energy up. Because at that point, like once we've all been there when you crash and then you're eating and like you're just eating to like not pass out. Like it doesn't feel good when you're eating that meal. Your stomach hurts, you're cramping. So meal timing is really important, because you want to try to pace out your meals throughout the day so that you do have stable glucose, so that you're not fatigued and you have brain fog and all these things. Like you want to try to keep a steady balance throughout the day.
Yeah, for me, I actually am kicking myself because I forgot to eat my snack before this. But like, I feel that like elevation where I'm like not grounded. I don't know what the correct actual medical terminology is, but when I'm starving, I'm just like, I feel the feelings of frantic.
Yeah, you can't focus.
Yeah.
I mean, I'm like a baby. I need to eat on my schedule.
Same.
Like, I need my snacks, I need my meals, and like I can't
Same.
really deviate too far from that. Like, go hours and hours. Like, I start getting like pain and tingling, and like I start feeling crazy. So
No, crazy.
yeah, I have to like plan in advance because I like it's just not fun.
It's like the Snickers commercials. I mean, if someone asks me to go to dinner after 6 o'clock, I'm like, what? That'll be my second meal. I'll go,
Right.
but like I will have a dinner before that dinner.
Yeah,
because I eat at 5:30 with my kids every night, and so when I like try to be social, and someone's like, "Oh, I made an 8 o'clock reservation," I'm like, oh, "Okay,
yeah."
It'll be
But
my
that's
second
great
meal.
though, because it sounds like you definitely have like that intuitive clock going on, where it's like like this is what my body needs right now. Because a lot of people are disconnected from that because of all of the messages that we're getting, and it's like, well, when do I eat, or when should I eat, or what should I eat this, or what and people are just like confused and they don't know when to eat or what to eat. So it is nice to be able to listen to those cues and have some kind of routine, because for a lot of people it's hard.
I do feel I've never used the label on myself as an intuitive eater, but at the core of it, I do intuitively eat. I think that's just anyone who's eating without like constantly thinking about it is intuitively eating.
Yeah.
However, with the caveat being that I get really intense decision fatigue, specifically around food, ever since having children. So for me, I'm honestly eating like primarily the same breakfast every day just because it's easy.
Yeah.
And I don't necessarily think it's like the best some days, but it's just like easy. I just don't want to think about it, quite honestly. I just want to like have it done and it's moved on. It's like
you're nourishing yourself, so it's like that is that sounds great.
Yeah, it's like
you're eating. So
Obama and why can't I think of the Apple founder? They talk about decision
Steve
fatigue.
Jobs.
Thank you so much. Yeah, Steve Jobs. And like wearing the same thing because they don't want to have to think about it.
Right. Yeah, I could see that.
Another question was someone who has family history, how can they reduce their chances? Maybe they're not testing now, but like how do they reduce their chances? Is it the same as
it's
same
pretty
kind
much
of thing,
the same.
movement?
Yeah, just like doing those things that will reduce your risk, like movement and eating balanced meals, like all of those things. These are things that are good for anyone, but especially, if you have prediabetes or you have a family history, the most important thing is going to be the testing in addition to doing all these things, because you don't want to go years and years without getting these tests, and then you go and like your blood sugars are spiraling. So I would say at least once a year, like get an A1C.
And then another question, and honestly I've wondered this too, and I don't know if you're as comfortable speaking about this because it's kind of falls into the realm of like OBGYNs, but what is gestational diabetes?
Yeah, gestational diabetes is diabetes during pregnancy. For most people that have gestational diabetes, it completely resolves once they give birth. So, but for some people, they do get, like, they remain in the prediabetes or diabetes range after giving birth.
Okay.
But for most people, it resolves. However, you are at a higher risk in the future of developing type 2 diabetes, and it's significant.
The risk is
significant. Yeah. So it's the same there. Like, it's just something that you want to be aware of, that you want to do your testing for.
Yeah. Does it come out of nowhere during the pregnancy, or were you maybe potentially like predisposed?
It could be a different like combination of things.
Okay.
Typically, you get tested around 24 to 28 weeks, because that's when you have.
Yeah, it's a nasty drink.
Oh yes, I'm aware, because I used to work at a prenatal clinic, and I worked only with people that had gestational diabetes, and I'm like, oh my god, like I think I would probably do just like the CGM, like the continuous glucose monitor, because I can't imagine stomaching a drink like that.
It honestly got better the first time with my first pregnancy. It was like this flat orange warm, like, oh my god, it was awful. Syrupy, and you're already so disgusted by everything because you're pregnant. So it's like drinking that is awful.
I had some women that would just like vomit it.
Yeah,
they would just like throw up.
I also just can't drink things quickly.
Yeah,
and you
same.
have to drink
I'm a
it in whatever.
sipper.
Yeah, like this drink I've had for 3 hours.
I'm the same way, and that's why I'm like, I don't know that I could do that. I would probably have to do a CGM, because the idea of having to stomach that amount of fluid, and I'm also just not a sweets person.
Yeah,
so yeah.
The second time I had it, it was lemon, and they gave it to me cold, which made a huge difference.
Okay,
but it's still not ideal.
Yeah.
Okay, sorry. So yes, that's when you do the test.
if you have a family history of diabetes, or if you have been in the prediabetes range before, you're going to be at a high risk. But also if you're older, like I believe it's if you're over 28 or 30, you're at a higher risk. yeah, so those are just some things to look out for. But with gestational diabetes, I mean, there's so many things that you can also do. The recommendations are a little different during pregnancy.
That's what I was going to ask, because the question was, if they had it with our first, how do you avoid getting it with your second?
Yeah. I don't recommend going low carb because that's
Okay.
something that a lot of women do when they're diagnosed, and you still need that glucose for your growing baby.
I can't imagine going low carb pregnant.
Yeah, I don't recommend that. It's not recommended, just like with the guidelines. And so you want to do the meal balancing that I was talking about and the meal timing. Generally in the mornings, your glucose levels are going to be higher in pregnancy because of the hormones. So I do recommend like a protein rich breakfast during pregnancy. Okay. Where maybe you just have like one serving of carbohydrates, which could be like, I don't know, maybe you have 2 or 3 eggs and then you have it with a slice of toast and that's it. You're not having like fruit or anything like that on top of it. And then you kind of time, like it's better to have smaller, more frequent meals throughout the day.
Okay, well that's good for pregnancy
yeah,
anyway.
to have more of a balance. But you know, it doesn't, like, if you do get gestational diabetes, it's not that you did something wrong or anything like that. Like, you know, it could just be really that your body's having a really hard time with all of the hormonal changes, regulating your glucose. And that could really be it. Yeah, that could be a lot going on. And some people just need to go straight to medication, and that's okay.
And there is a medication that...
Oh, yeah,
okay.
Insulin.
I didn't actually know.
Insulin is like, one of the most effective medications in pregnancy. It's super safe. So for, a lot of people who have like uncontrolled gestational diabetes, they would get on insulin. And there's different types. Like you could do like just 1 shot a day, which will cover the whole day. And then if it's really high and it's still not coming down, you could do it with every meal. So there's different like treatment options.
And then lastly, and I actually don't even know what this term is, LADA.
Yeah.
What is that?
So that's diabetes 1.5.
Yeah.
And it has characteristics of type 1 and 2.
Okay.
And there's an autoimmune component to it where your body is, attacking the cells that produce the insulin, but it doesn't happen as quickly as like a type 1, which is why it's usually diagnosed like earlier in age. So people that are older can get type 1.5, and eventually they will probably have to get on insulin because of the autoimmune component. But it's unique in that something autoimmune is happening, but you're not necessarily getting diagnosed at a younger age.
Okay, so the question was, is it curable with lifestyle? Obviously, it depends.
Yeah, it depends. I think for many people, it's the autoimmune component. Like if your body's attacking those cells, then like eventually you're probably going to have to get on insulin. But it's good to see the right provider, like seeing an endocrinologist who focuses on diabetes, so that you're getting the right testing to see, like, do you have the right diagnosis? Do you actually have type 1? Because if you have type 1, you're going to need the insulin. And there's nothing wrong with insulin. It's like very demonized. With type 2, it's seen as like the ultimate failure when it comes to medication, but it's actually very safe if you're using it properly. And it's been one of the most studied medications. So there's nothing wrong with taking insulin.
Why is it seen as the ultimate failure for type 2?
Because it's an injectable, and people feel more comfortable taking oral medications because it's not fun to have to inject yourself. But now there's a lot of options. Like there's pumps that you could just leave in your body. The needles are a lot finer now, so they don't hurt as much. There's just been a lot of advancements with diabetes care.
Can I ask a really dumb question?
No,
the patch that people wear.
The CGM patch.
What is that?
So that's a CGM.
I'm just thinking about
I'm assuming it's probably a CGM because a lot more people are wearing them now. It's a continuous glucose monitor.
Okay.
And
is that for type 1 or type 2 or both?
It could, honestly, a lot of people that don't have diabetes are wearing them now.
Interesting.
Yes.
Okay.
It's very big in the wellness world because people want to see what their numbers are, like how different foods affect your blood sugar. And if you don't have diabetes, like just know your blood sugar is supposed to go up when you eat because that's what's supposed to happen. So it's not a bad thing when you have those ups and downs. But for people that have diabetes or prediabetes, it's helpful because you can identify trends with different foods. Because, like, for example, I might eat white rice and it might not have a significant effect for me, but for you it might. So you can identify those trends. Whereas, like, with a glucometer, which is when you prick your finger, it's like you're taking it at that moment in time. The CGM works you leave it in for 2 weeks. So it's just working,
and you're just getting it somewhere else, like
on your app. Okay. Yeah, it syncs with your app. And then like for us, our patients sync it to like our EMR, which is like our platform that we use. And so we get access to their numbers, and then we can talk about it together.
Okay.
So it just gives you more information,
Okay. Because I actually was wondering that, because I know someone who wears one, and then also like I saw Chrissy Teigen and John Legend said that I guess their child was seen wearing one at the Olympics, and so then they came out talking about, I don't know, it was their son, I think, when he was holding up a sign, he was wearing one, and so she came out saying he has diabetes. I forget if it was pre-diabetes or diabetes.
Well, yeah, probably type 1 then.
Yeah. So that just caused interest for me. Okay, for someone who's listening to this who is like diabetic, looking for care, how would they use digital diabetes?
Okay, so
diabetes digital.
Yes, it's confusing.
As I said it, I was like, wrong way.
The other way. So we provide nutrition counseling. Again, like most people don't have to come out of pocket because your health insurance will cover it. Yeah, it's a great benefit. You get unlimited sessions. And so we have a 12-week program where we meet each week for an hour. Because when you go into like the hospital or the clinic, usually the visits with the doctor are like 15 minutes. You don't have much time. And they also don't have a background in nutrition. And then when you meet with a dietitian, it might be like 30 minutes. So it's nice because we have more time. And so we go into all the things. We coordinate care. Like if you're seeing a therapist, we coordinate care with your therapist, with your primary care, with your endocrinologist. With diabetes, you have to also take care of your feet, your eyes, like all those different things.
Why your feet?
Because you have decreased sensation. Like when your blood sugars are really high, it affects your circulation. So you might have tingling in your extremities, like your feet, your hands. And so let's say that you're walking barefoot and I don't know, you like it's like a small cut. You might not even realize it because you don't have that sensation. And then because the glucose is higher, the infections happen really quickly.
Interesting.
And so, yeah, it's a very big complication with diabetes where it might progress to like an amputation very quickly because of the high glucose in the blood. So those are things that like, a lot of people don't have to think about, but like for someone with diabetes, you have to make sure that you're doing your podiatry visits every year. You're checking out your eyes because you could get like nerve damage very quickly. Dentists, because again with the bacteria infection, so all those things like we coordinate, and we focus on nutrition, stress reduction, hydration, like all those things throughout the 12 weeks. And then after that we do maintenance, so you might see us like every other week or every month just to make sure that you're getting your labs done. We can order labs as well for you. Awesome. If your doctor's like really resistant to it or whatever, it doesn't cost much, so we can order those labs for you as well.
Amazing. Yeah. Well, congratulations on the
pivot.
Pivot.
Thanks for having me.
This launch. Of course. I'm literally, I knew nothing about diabetes. This was actually so informative.
Yeah, you asked really good questions.
Wow, thank you so much.
These are like great questions because I feel like the average person, they don't think about this stuff. They might know someone with diabetes, but they're like, I don't know.
Well, that's why I love the show, and I feel like you probably felt the same way with Food Heaven, of being able to bring in people who have experiences that I have no knowledge or experience with to help listeners who are going through something that I may not be going through. Exactly. It's like I can share my story so many times over, but it's not going to apply to everyone, and people are going to care about other things as well.
Exactly. Yeah, that's what I loved about doing the podcast. I mean, we still have now our podcast is Diabetes Digital. We replaced it with Food Heaven, but that's what I love, like with having people on, is that you can talk to people from different like backgrounds, especially professionals. It's like you kind of pick their brain.
It's so enjoyable. And I've also made such incredible relationships with people who I would have never had access to otherwise. Like I would have. Also, it's when do you ever sit down with a stranger and have a conversation?
Exactly.
Like
it's your way to socialize.
Very rarely are you getting to know someone that you had no context with beforehand. Maybe you're meeting someone at a party and it's like, hey, how are you? Okay, so nice to meet you. But unless you follow up and go on like a coffee date or something, you're not really sitting down with people you don't know to converse.
Yeah, especially working like from home. Like, I'm just kind of in my own shell. And it's like especially with COVID, I like lost a lot of those people skills. And even coming here, I haven't done like an in-person podcast interview I think since pre-pandemic, actually, it's all been virtual. So it's like you kind of lose those skills when you're just like in your own little shell.
I leave places and I'm like, why did I say that? Or like, do I know how to converse? Like,
you're like, oh,
what
yeah,
is
I get like all awkward
here?
and stuff. I'm like, damn, I've lost some of my people skills like post-pandemic. So it's good to exercise that.
Like I've lost it. Well, thank you so much for coming on. For people who want more of you and want to support you, where can they find you?
Yeah, so our website is diabetesdigital.co, and then we're on Instagram. We're still active on Food Heaven, just not as active. Yeah. So Instagram is Food Heaven, and then Instagram is Diabetes Digital Co.
Okay, awesome. Right. Well, thank you for coming on.
Oh, thanks for having me. Yay.